Welcome to our podcast. Today we're going to be discussing acupuncture versus dry needling. Probably the most common question we get asked, both here at Breeze HQ when we're fielding queries and also when we're delivering our courses worldwide. There's a group of people who think that they want acupuncture. There's a group of people who they think want dry needling. And in reality, they probably want a little bit of both. So what today's pod is going to all be about is let's delve on in there, dive in there, and figure out what the differences are and what the similarities. Let's go and give it a go. So to kick off, I kind of have this idea, right, that let's look at it from a high level. Well, what are the high level differences? And if we're going to just keep it really simple, what would I say are the differences between acupuncture and dry needling? One, what is the outcome you're aiming for? Depending on what you want to achieve, will decide on whether you do dry needling or acupuncture. The second thing, where do you put your needle? Because in acupuncture, there are set places that you put it. In dry needling, there are set places that you put it. Sometimes there's an overlap, but actually what you're looking for anatomically is very different. And then finally, what do you do with it? You know, what are you actually doing with your needle when you're doing either dry needling or acupuncture? That's kind of, I guess those three things are the ones that make you say, right, this is the differentiation between the two. So I'm going to kind of go into some specifics now. So first up, let's go on about outcomes that you're looking for. For me, dry needling is about being super focused on the musculoskeletal pain elements. If somebody's coming in and they have like a lack of range of movement, or if they're, you know, when your clients are talking about feeling tension in an area, they might say, it just feels like a knot, my pain just feels there, feel a load of tightness. Those are the kind of things that make us think, right, this might be a dry needling approach here. All right. So I think that's where dry needling really sits in its own and, you know, really makes a claim for itself to go, right, this is me, this is my job. This is when you should choose me. It's when we've got that kind of tightness, muscular type problem, pain, lack of range of movement. With dry needling, it's short-term gains, right? So you're probably looking at maybe like an hour's benefit. So not very long at all. That's not to say that that's bad, because in some instances, that's all you need, right? If you're thinking about in a scenario where you're looking for performance, you're looking to improve somebody's performance, that is perhaps where dry needling sits lovely, because, you know, it's super dramatic. Like, we're talking about symptom changes within 20 seconds with dry needling. So super quick, super dramatic. And I think that probably leads on to my third outcome, you know, for dry needling, which is if I feel like somebody really needs to get on board with what I'm talking about, I'm trying to give them perhaps some education, some advice, an exercise prescription that I can see that the maybe's a bit, I don't know, the maybe's not buying into it, right? The maybe's not like going, yeah, I totally feel this. And I feel like they need something more. And I'm really going to draw on the strong stimulus that dry needling gives, because you know that you're having dry needling, right? It's not like, it's not inconspicuous. It's like, it is there, right? In your face. So you know what's happening. And to me, this kind of activates a lovely psychological trick that we have called the halo effect. So because you're giving somebody a big stimulus, and if they see like dramatic results very quickly, the halo effect kind of goes along the lines of saying, well, if I see something as a positive, the things right next to it are also positive. So if I've given you like a big positive change in your symptoms, range of movement's lush, pain's lush, like totally loads better, they're more likely to buy into you, buy into what you've got to say. So although I might be dealing with a problem that I think needs to be sorted for longer than an hour, which is a lot of stuff that I would have seen in my caseload anyway, I might go with a dry needling technique, which is kind of just like getting them on board with it a bit more, because they've got a reason to believe in you. You've done something that's seen a visible change, a palpable change for them. And they're like, well, hold the phone. Maybe this dude doesn't know what they're doing. So I kind of think that's another reason why I would go for it. And I think Really, to summarize what I'm using dry needling for, it's when I'm looking for a short window of opportunity. I'm looking at a very specific time frame. So it may be that, let's say I've got a footballer and they need to get back on the pitch, or it's pre-game and they're like, look, I feel like my stride length is short. Could be a tennis player that feel like the wingspan is just that little bit reduced. That's what I'm thinking about dry needling. I'm not thinking about acupuncture whatsoever. All right, I'm thinking about dry needling in these instances. If I'm thinking that I'm going to be doing some kind of rehab as well. So it may be, if I was, an example I use all the time is like, say I want to get somebody on the squat rack and they just can't get to that end range of a squat for whatever reason, right? Discomfort, just feels they don't have the range to get there. Dry needling's lush because I just get whack out some massive needles, get it into piriformis, get it into glute med, glute max, glute min, all those cheeky little numbers around the pelvis. And because I can be really quick with that, they get a reaction to it, get them on the squat rack, get them really deep squatting, and they might never need dry needling ever again, right? Because it might have just been that little bit of a leg up, that just that little bit of there you go, and off they go, and they're able to get full range into it. They're able to do their strengthening, their power work right at that end of range. And that might be all that is needed. So that's where I'm thinking about dry needling, right? For acupuncture, completely different. Well, yes, I would say predominantly different. I'm not thinking about acupuncture for short-term benefits. I'm thinking of acupuncture for that longer-term benefit, but it has such a massive, massive scope of practice, right? So we know like the elite athletes, like the elite of the elite, your LeBron Jameses, your Steph Currys in the NBA, these guys use acupuncture all of the time, right? And they're using it for performance. They're often using it for recovery as well because they feel that it helps them get over like DOMS, that kind of stuff really quickly. I did a systematic review with one of my master's students a few years ago, and we looked at acupuncture and the recovery of DOMS, and I'll be honest, there wasn't really anything there that says acupuncture makes a difference. However, these guys playing 2, sometimes 3 games a week, they're trying anything and everything. And if they've stumbled across something that works for them, well done them. But there's a load of other stuff acupuncture gets used for. Persistent pain, right? We've got nice guidelines. We've got high quality randomized controlled trials that say, yes, let's work this out for persistent pain. Migraines. We've got overactive bladder. Myself and Emma did a Cochrane review on this a few years ago, right? We've got hot flushes. Look, general well-being, anxiety. There's a huge raft that acupuncture does. So whereas dry needling is very good for your muscular pain, your muscular tightness, that tension in the area, acupuncture is a much broader church, all right? And it'll be able to be used for a lot more different things, and you're more likely to have a longer-term benefit as well. So I think perhaps if somebody, so let's say somebody's coming to me clinic with pain, and this is a kind of an overlap position. Well, do I go for dry needling? Do I go for acupuncture? I'm thinking I go for dry needling if I'm looking for a short-term benefit, if I'm looking for like a performance-related benefit. If my patient is not describing lots of the psychosocial and lots of other things going on in their life. I'm going acupuncture if I'm thinking I want a longer term benefit, if I'm kind of going into this realm of looking for a treatment. So like I guess I'm going to be hesitant to say resolve someone's symptoms, but hopefully make their symptoms a lot less for a lot longer anyway. And particularly if they're talking about some of the psychosocial elements in there, because acupuncture comes lovely into that. All right, so where do you whack the needle? All right, so with dry needling, you're going to whack it into trigger points. So trigger points are tender, hard, contracted muscle compartments or segments, okay? Not a full muscle belly. So if it's a full muscle belly, that's more likely to be a spasm. If it was a part of a muscle belly, we can then define it as a trigger point. Yes, trigger points are controversial. Yes, I know there's a discussion to be had as to what they are and what the physiology behind of it is. But look, I feel hard nodules on people when I'm in their traps and their rhomboids. So I think it's as an entity, it exists. Okay, what it is, okay, we're not so sure. But basically what we would do is we find a trigger point and we whack a needle into it. All right, so we find the trigger point, there we go, oosh, there we in. Trigger points aren't always there. All right, so you could go back the next time, you might find that the trigger point isn't there at all, or you might find it's in a slightly different place. With acupuncture, this is delivered to acupuncture points. So acupuncture points are anatomical regions, anatomical things. They are always present, so they're always there, regardless of whether you've got a symptom or not. And they almost always are on meridians, which are set channels and pathways of where your energy is supposed to flow. What I would say with acupuncture points, whereas trigger points are always in a muscle belly, acupuncture points aren't always in muscles. So I can think of some examples where you're thinking like yin tang, which is between your eyebrows, on the ear, so the auricle of your ear, around your Achilles tendon. There are loads of examples where actually an acupuncture point isn't always on a muscle belly. All right, so what are you doing with a needle? Dry needling tends to be one in and one out. So you find a trigger point, you whack a massive needle in there, you get cracking on. 20 seconds, hopefully it's relieved it. You get them off the bed, away they go, right? So it might be one needle, it might be 4 or 5 needles, but you're only ever doing it one needle at a time with this one. With acupuncture, rarely, if ever, would it just be one needle. I would say maybe 4 needles at the absolute minimum. I'm just kind of like throwing a number out there. I mean, I can't even think of a time I'd just do 4 needles, to be honest. But, well, some recipes, 4 gates, for example, that would be a good example where I'd maybe do just 4 needles, but they're in really powerful points, right? So, I don't know, let's say 4 is your minimum. Maximum, I'm probably going 15, 18, sometimes 20, depending on how bad the symptoms are and how long the problem's been and whether it's reacting to treatment. But point being here is that dry needling is 1 at a time, usually. Acupuncture is multiple needles and they're left in for a lot longer as well. That comes out of the dosage, right? Because the dosage with dry needling, as I've said, 20 seconds at a time. Sometimes not even that, 3, 4, 5 seconds, right? Acupuncture, acupuncture sessions sometimes are going up to like 40 minutes. So it depends on what you're trying to achieve with it, whether you're looking at more descending inhibition, you're looking at more like that acute pain physiology, or whether you're looking at things like more chronic pain and persistent pain. If you want to do that, you tend to leave your needles in for longer, but I kind of would say the upper limit for acupuncture is about 40 minutes. The lower limit, you're probably not wanting to do it for anything less than 15 minutes. So very different in terms of dosage, right? Dry needling, 20 seconds, usually max per needle. Acupuncture, you're talking about 15 minutes minimum, all the way up to 40, 45 minutes. Physiology-wise, there's a difference. So, and this is where the controversy lies, I think, with dry needling, is because dry needling relies on this concept of a trigger point, we then have to assume that a trigger point exists and we know what a trigger point is. And I'll be honest, you look at the literature, you look at the theory, they don't always match up, and we're definitely yet to provide robust evidence of what a trigger point actually is. But the prevailing theory, the one that kind of makes sense about what we're trying to do here, is that we're trying to disrupt a dysfunctional motor end plate. So we have a motor end plate. So we have 2 fibers that are kind of stuck together, that are meshed together like this, really interlocked. Sorry, those of you that are just on the audio form here, I'm actually showing you with my hand. So if you want to go and look at this on YouTube, go and be our guest, right? But like, you got an interlocked muscle belly, and that's a muscle contraction. That's what it should happen. And it's kind of stuck in this position. It won't shift out of it. And what we're basically doing is we're putting a needle into that sort of contracted area, and we're just being absolutely vicious about trying to like forcefully separate this dysfunctional motor end plate. The problem with it is that we think that the action of trying to disrupt the motor end plate usually causes pain, or should we say a strong stimulus. And because we're doing that, we're creating a chemical reaction to that. So we get neuropeptides that tend to be like the optimal environment for the trigger point to come back. So I'm going to show you the difference of application to these, right? I've got 2 test subjects here. I have got my fake piece of skin, which I can assure you feels not like any skin I've ever felt before. And if I'm honest, if I did feel that as skin on somebody, I'd be pretty scared, right? Because it doesn't feel like skin at all. But maybe it just has some of the similar qualities in terms of texture and stuff. And then I also have Grengador here, this little teddy who comes with me on my travels because my daughters like to think that I've got some companionship when I'm traveling around and going to all these far-flung places, teaching acupuncture and dry needling. Right, so a couple of bits and bobs, right? If I'm going to be doing an acupuncture approach, right? So my acupuncture approach, so both scenarios, right? We're going to use the same tools. So a dry needling isn't a different needle. It's exactly the same kind of needle as it is with acupuncture and vice versa. So I guess depending on what you want to achieve and what you if I was wanting to have a really strong reaction, I'd go for a thicker needle. And if I'm wanting to go for a lot less of a reaction, I'd go for a thinner needle. But, I'm splitting hairs here. It's very rare that I'd go and choose thickness of a needle over the length. Length's normally the thing I'd go for. So with acupuncture, when we're putting our needle in, right, our depth is dictated by what the textbooks and the manuals tell us. So the textbooks and manuals will tell us, this is 1 sun in depth. Sun, chun, 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 chun. Lots of different ways of saying this. I say sun, right? I'm a Geordie, so I'm probably not saying it right, but I think some people somewhere in the world would also say sun, right? So C-U-N, sun. So it'll be about the sun depth that's written in a textbook or in a manual. That's how we know how deep to go, all right? Or that's our maximum depth. And so what we would tend to do is we tend to insert our needle to that given depth. And we may or may not, depends on who the practitioner is, we may or may not stimulate the needle. You may have heard that, or you might do that yourself. And what we tend to be doing when we're stimulating the needle is in and out, and also spinning the needle backwards and forwards. And we're looking for our client, our patient, to get a response. So we're looking for a specific response, which shouldn't be pain. It shouldn't be discomfort. It's often described as weird, warm, ache, weird, and all that kind of jazz. So those of you that are needling, you've heard this, you've done this before, right? And I guess if I'm going to be using this on Grengador here, right, what acupuncture is like, if I've got an acupuncture point here, or I've got an acupuncture point here, I'm always needling there, right? That point there is always there. Let's just say, for want of an argument, that is large intestine 4. Large intestine 4 is always there. Okay, whether I need to needle it or not, whether it's painful or not, whether there are symptoms there or not, large intestine 4 is always there. All right, so I just tap my needle in and then I push it in. Oh, well done, Grengador. You're super brave. And then I twist that needle. Yes, Carl, that's it. I'm feeling tingly and aching, warm and weird. Excellent. Look at that. Fantastic. Thank you, Grengador. So that would be acupuncture. You will see that it's a fairly gentle approach. It's considerate. It's thinking about engaging with your client and almost like trying to make some kind of connection as to what they're feeling. Dry needling, on the other hand, is, let's say, less about the connection and more about what you as the therapist feel. Okay, so your depth when you are needling a trigger point, remember, because dry needling is about needling trigger points, is more about what you feel. So what you as the therapist feel, and it's about the change of resistance. So when you're pushing a needle into some flesh, you're going to get to a point where you're like, whoa, all right, that feels like it's just a little bit harder to push in, okay? And it's at that point, that's kind of where your depth is dictated by, right? So you've got your depth, right? That's where your resistance is there, lush. And then when you get there, super vigorous, yeah, going mad, right? Like in and out, twisting it all about. It's like Tai Chi on crack, right? You're going absolutely mad like this, all right? So in and out, twisting it all about. Like just going absolutely hell for leather, because the point of this is that you want to get that motor end plate relaxed, right? And you're literally going mad. So whereas in acupuncture, it's a lot more, I would say, and oftentimes it's quite, I would say, more gentle. Let's say we'll do in comparison to dry needling, right? It's more of a gentler type needling, and it's definitely more in conversation with your client about what they're feeling. With dry needling, just gone absolutely hell for leather, right? And poor Grengador here, if Grengador was coming on here and we need to do some dry needling, I'm assuming Grengador's come in because they've got an important match here and they've got a problem. Let's say they've got a problem with stride length and say, oh, dude, we need to whack some needles in your piriformis, yeah. And he's like, how then, Clarkson? Go for it. All right, son. All right, son. And we'd go for that, right? So we'd palpate around. And remember, with dry needling and trigger points, there might not always be a trigger point there, all right? Acupuncture points are always there. Dry needling or trigger points are not always there. But let's say we found a trigger point. Oh, that's it. That's the spot. Grengador says, right, let's whack this in. We whack our needle in. Our depth is dictated by the change of resistance. And when we get to that resistance, boom, mad. And often, your patient's is like, and it's all right, if they're crying for their mammy, we don't care, all right? We're just going mad and going for it, right? And then effectively, that's the big difference, right? So acupuncture is probably more subtle, more gentle, more considerate of the person in a partnership, whereas with dry needling, it's a lot more vigorous and more about what the therapist feels. Just putting a couple of caveats on here. Obviously, if you don't needle, if you haven't been needle trained before, don't do any of this. Come on, let's not be fools, right? Obviously, if you're needling somewhere over the thorax or even the torso, don't just go bowling on in there and not thinking about it, right? Do your training, right? You don't want to be one of these people who have caused a pneumothorax, whether that be, malpractice or whether it be by accident. And I think most of the times it would be by accident, right? Sure. But, so I can see a scenario where somebody may have been dry needling and they just didn't really know what they were doing. So look, if you're not used to needling over the thorax or the torso, don't do it over there, right? Get shown how to do it. It's not worth the absolute heartache and the pain and the suffering that you will be going through as a clinician, as a therapist, what they will be going through if you puncture a lung or something like that. So I'm kind of going through these techniques to give people who already needle and already know the safety elements, right? So if you don't do it, you don't not normally do it, go and get some training, right? Don't try and think that you're better than that and can figure it out yourself. There you go. There's my little bit of serious bit out of the window there. So anyway, there you are. These are different techniques. So my closing thoughts on this, I'm a big advocate of both. I think acupuncture is fantastic. I think dry needling is fantastic. I think if I was going to be pushed and someone to say, like, which one would you choose, one or the other, it probably would be acupuncture because, acupuncture has got the best evidence base. The evidence base in dry needling is poor. It's not at the same level as what it is in acupuncture. So dry needling has to kind of piggyback on the back of the dry needling literature. I feel that acupuncture has a much broader scope, so we can use it for a whole raft of problems, and really kind of probably fits more with the more contemporary way we look at trying to deal with conditions, because it's not just about one condition or one problem. It tends to be a biopsychosocial approach. So with acupuncture, you tend to use it for loads of different things, right? That said, I do think dry needling is better in those short-term, we need to get a benefit now type scenarios. So there's really small window of opportunities. If I'm thinking about, I'm working in an elite sport club, if I'm working with a performer, or I'm wanting to do a rehab session where, I want to get somebody on the squat rack, or I want them to get full range of movement and then see if we can do some strength power work at that end of range. That's where I feel dry needling really comes into its own and probably trumps acupuncture. So for me, acupuncture would be my go-to because it's got the high quality evidence base. It's got a huge application. It's got tons of options for where you could put your needles and what have you. Much more likely to have that impact on the body and mind. But I think dry needling does have its position and its place when we're looking at really small, short-term changes and when we're looking at like a kind of like a performance-related approach. I hope you found that helpful. I hope you found it interesting. Please get in touch with any questions, queries, any suggestions you'd like to see in the future. See you soon.